Again, welcome to the 37th National Pesticide Forum, and a special thank you to the Children's Environmental Health Center of the Icahn School of Medicine at Mount Sinai, which is a co-sponsor of this event and has been instrumental in helping us bring everybody together here. Beyond Pesticides was founded back in 1981, and one of our strategic goals from the very beginning was to align with the medical community, to identify the hazards of pesticides and understand the impacts that they have on living systems, track the regulatory system to see whether it was adequately protecting health and the environment. And we continue to do that to this day. Our feeling is that as activists, as advocates, as policymakers, as people in elected positions, we have to know the science. We have to stay current with the science. It's our job to explain the science as the basis for eliminating exposure to toxic chemicals. Much of our work is guided by the work of Rachel Carson. It was mentioned last night. The quote that sort of moves me and inspires me as I go around the country and meet with groups is this, out of Silent Spring. By their very nature, chemical controls are self-defeating, for they have been devised and applied without taking into account the complex biological systems against which they have been blindly hurled. The chemicals may have been pre-tested against a few individual species, but not against living communities. And the way I interpret that is that we're talking about communities, as we did last night, both in the soil, biological communities. We're talking about beneficial organisms, both bacterial, fungi, and others that are cycling nutrients and providing food for life, for plant life. We're also talking about biological systems, our bodies, organisms in the environment, ecosystems, and that is critical to our work and understanding that. And then, of course, we've read about the insect apocalypse. The entomologist from the UK who has been extremely influential in this field in tracking beneficials, or pollinators, I should say. Terry Shistar on our board doesn't like when I use the word beneficials because every organism has a role in the ecosystem, and that role is important. Whether we view it as beneficial or negative is not the point, but they are all working in balance with each other. So I try to get that out of my vocabulary. I'm not successful at that, though. Anyway, Dr. Goulson says, we appear to be making vast tracts of land inhospitable to most forms of life and are currently on course for ecological Armageddon. And he wrote that way before the New York Times Magazine had their cover story in November of last year. And then there's the climate crisis. These are all catastrophic events that we're facing in the future, and the question is, what can we do to reverse course on this? So there is a new urgency. I think we all feel that, and I think we have to incorporate that sense of urgency into the work we're doing here today. There is a tendency, however, to focus on individual bad actor chemicals. Have you noticed that in your communities? I mean, whether it's glyphosate or the campaign against chlorpyrifos, these chemicals have to go, certainly. But here's what Carrie Gillum, the author of Whitewash, told our conference last year. She said, glyphosate Roundup is the poster child for the bigger pesticide problem. If it goes away tomorrow, we are not okay. But I do think that it is very representative of what is going on in terms of the way that it has been pushed and the way that the company, in this case Monsanto, has manipulated public policy and the regulatory authority. So clearly we have to address what we're doing here over the course of this conference from the standpoint, as we heard last night, from a systems approach. A systems approach in which we bring values, we bring ethics, we bring principles about protecting health, protecting the environment, and we do that in a way that engages the democratic process, engages local decision maker, our parks directors, our elected officials. We, the community, are part of that process, that decision-making process. There's the democratic process. There's transparency we must demand, right? There's stakeholder assessment and control of what is used in our communities and what our children are exposed to. It's a reliance on science and the experiences that we have, whether we're victims, whether we're farmers, whether we're gardeners, whether we're exposed in any manner. And then it's meeting our expectations. What do we want? What do we expect in our community? You know, all these principles I just read are in the Organic Foods Production Act. It's part of U.S. law. It is a standard in U.S. law. We're not using it broadly enough. And we are committed to bringing these standards to New York City. There is a core group of folks in this room that are working very closely with the legislative process to bring these principles forward. Clearly, what we're doing here over the next day or today and this evening, please come tonight to see the film Ground War. I think it will move you, and the panel discussion afterwards. We're expecting Lee Johnson, the guy, the groundskeeper who contracted non-Hodgkin's lymphoma and sued Monsanto and won $289 million jury verdict, will be here this evening. But we are hoping that we can hone our ability to discuss these issues holistically. And when I say holistically, we're talking about, yes, the systems approach, but when you step back and look at what we're doing here, and as ambassadors, as leaders, as those voicing these concerns, we really do have the solution, I believe, and I do have some optimism about bringing this solution forward, to address these catastrophic events that are in front of us. When you look, for instance, at organic systems, look at what organic systems, if properly implemented, can do. They can improve soil quality. They can minimize energy use, increase biodiversity, minimize water pollution, reduce worker applicator exposure to pesticides, improve ecosystem services, and cost equal or less than what we're doing now with chemical dependency. So this is a framework for moving forward. I think you all know a lot of this. The question is that, you know, we need a lot of energy to move this thing forward, and we need your energy, and hopefully this is a conference that energizes and inspires. I know I'm inspired by you all being here and the work that you do, and let's use this opportunity to re-energize ourselves and move forward. Thanks so much for being here. So I want to introduce my friend, Routt Reigart. Dr. Routt Reigart is a pediatrician. I used to see Routt leading meetings at EPA as the chair of the Children's Health Advisory Board for Carol Browner when she was EPA administrator under the Clinton administration, and really sort of moving the children's health issue forward on a national level. He is now a professor emeritus from Medical University of South Carolina, but continues to do clinical work in South Carolina throughout the state. And so it is such an honor to have Routt as the president of the Beyond Pesticides Board of Directors. I can't say enough about Routt and his dedication to this cause, so thank you, Routt, for being here.
Thanks, Jay. We're now 1 minute late starting our first plenary, so I'll be very brief. Beyond Pesticides is really delighted to be in New York City. We're very pleased and grateful to the Icahn School of Medicine at Mount Sinai for co-hosting this event. We love this room and this venue. It's really exciting to be here. I welcomed many of you last night. I'll welcome you again. Good morning. We're delighted you're here, and we're really excited about the rest of the day. Thank you for being here. And I don't know, Jay, are you going to introduce Maida?
So when we started organizing the conference, we worked very closely with Sarah Evans and Carla Azar at Mount Sinai, and the first name that came to the top of the list as a speaker today was Dr. Galvez, Maida Galvez, who is Associate Professor of Environmental Medicine and Public Health at the Icahn School of Medicine at Mount Sinai. Unfortunately, I don't have a great deal of background, but I know that you have been a guiding light at the department, and we really appreciate you being here today and participating in the meeting. Thank you.
Good morning. It's great to join you all today and to provide you an official welcome from the Icahn School of Medicine at Mount Sinai. Is there a way to get the slides up? There we go. All right. So the Institute for Exposomic Research is directed by Dr. Robert Wright and Dr. Rosalind Wright at Mount Sinai, and they send their greetings to all of you today. It's really the guiding force for us, the umbrella under which all of the activities around children's environmental health are organized. And what I've appreciated about being at Sinai is that they've always defined environment broadly, and it's encompassed all the chemical exposures that families are exposed to, including neighborhood exposures and the social context under which those exposures happen. And so you can see from all of these labels that we have a National Institute of Environmental Health Sciences P30 Center, which provides the infrastructure for promoting research and community-engaged research through our institution. Our Children's Environmental Health Center, which Jay Feldman mentioned, which is the powerful outreach and education arm of all of our work. And then the clinical translational arm, which is the Pediatric Environmental Health Specialty Unit and the New York State Children's Environmental Health Centers, which I'll tell you some very briefly about. And so I just want to give a shout out to all the folks here that have been involved in long-standing longitudinal cohort studies that have really advanced the science, that have armed the advocates with the research that they need to advocate for healthier environments for all families. And so the NIEHS, EPA, Children's Environmental Health and Disease Prevention Research Centers, which are located across the country. Can we have a show of arms of people who have been involved in those projects? I know Dr. Rao is here, Dr. Jia Chen is here, several others. The Breast Cancer and the Environment Research Centers, which have encompassed not only academicians and clinicians, but also advocates. Are any of the advocates who have been involved in the BSERP program here in the audience today? So that's something that I was a part of in my training. And then these newer efforts, the Children's Health Exposure Analysis Resource and ECHO, Environmental Influences on Child Health Outcomes, both supported by the National Institute of Health, which are really continue to advance the science. And so the P30 that I mentioned is a way for us to translate research to action. And you see on the left our Mount Sinai team, and Lou Squell is here today in the audience, and our former coordinator, Rachel Manning, who's with the Fordham Law team, is also here today. And then you see on the right-hand side all of the diverse stakeholders that really take the evidence and use it to inform programs and policies that prevent and reduce exposures. And so it really takes this interdisciplinary team in order to do that. So oftentimes the interventions are not in the clinicians or academicians' hands. They're actually in the hands of the folks that are frontline in the community, whether you're the advocate, whether you're in housing or law or education. I think that many of those folks are here in the audience today. And what you're doing is arming yourself with the latest science so that you could be the most effective advocates for families and children. And so the Pediatric Environmental Health Specialty Unit was founded in 1999, started by Dr. Rod Lamler and others in the federal agencies, CDC, ATSDR, and EPA. And it's a mechanism for families and healthcare professionals to get their questions answered about environmental exposures, whether it's where children live, learn, eat, sleep, or play. At Mount Sinai, we cover Federal Region 2, which covers New Jersey, New York, Puerto Rico, and the U.S. Virgin Islands. And Dr. Perry Sheffield is here in the audience today. She's our co-director, and she's been doing a lot of work in the Caribbean to promote healthy environments for families in Puerto Rico and the U.S. Virgin Islands specifically. And we're really thrilled that we're here in New York State. We're actually the first in the country to have a state-based model that replicates the national PACU network. And so we have children's environmental health champions at children's hospitals across New York State in Albany, Buffalo, Syracuse, Rochester, Westchester, New York City, and Long Island. And so New York State has said loudly and clearly that we care about children in the environment. And we hope that this becomes a replicable model for other states in the country. And what we're trying to do is shift to a prevention model, meaning that we're trying to actively screen high-risk families for environmental concerns as part of routine well child care and connect those families to needed interventions. And ultimately, what we're trying to do is what Mr. Feldman shared with us. We're trying to speak with one voice, and that's when we're most effective. And so some examples is Children's Environmental Health Day was just last year officially proclaimed in New York State by the Assembly for the first time. And we held the celebration here, actually, at the New York Academy of Medicine. And there's the proclamation, and our community partners from state agencies, state representatives from federal agencies, and community partners from Clean and Healthy New York, and We Act, and Cecil will be speaking here today as well. And this is a video message that a 5-year-old shared with us that day, and it shows you the power of the youth's voice. And I just want to share that really quickly with you. We'll see if this works.
3. The aim of children's environmental health day is to raise awareness about the importance of clean air and water, safe food and consumer products, and healthy environments to children's health and development.
And it shows you truly fantastic. This superstar is in the audience today, and it shows you his dedication to children's health and the environment. And so we need to tell the world, and it's really youth that are inspiring us today. And so here are a group of 7th graders who are fighting for the survival of the planet. And this video that was shared on Mayor Bill de Blasio's Twitter feed has been seen by over 80,000 people, which is kind of amazing. These are truly rock stars. And then Lou Squell and I recently visited the High School for Environmental Studies here in New York City, and these are the youth who participated in the climate march. Us as a future, we are the ones who are going to be most affected. We need the world. We have to continue to fight. We can't stop. And those are our guiding words for the next day, for the next couple of hours, is these are the folks that we need to fight for. And I'm so glad you're all here to join us. Thank you.